Welcome back to my YouTube channel. In this video, we will discuss about outcomes defined as well as factor affecting the patient outcomes and diversity of the patient outcomes. Let's start the video. The Guide to the Physical Therapist Practice defines outcome as a systematic examination of the patient outcome in relation to the selected patient variable, age, gender, diagnosis, intervention performed. Therefore, when measuring the outcome, the therapist must consider the dynamic nature of the evaluation and the treatment of the individual patient as well as multiple options for the outcome assessment. Box 22.1 lists both the clinical and non-clinical factors which in addition to the intervention plus the random events result in the multiple possible outcomes noted in the table 22.2. In choosing a comprehensive and sometimes diverse method for the outcome measurement, the therapist must be familiar with the psychometric properties of the tools or the tool being used for the patient assessment. For cross-sectional clinical purpose, it is important to use the outcome not only to inform the clinical decision making but also provide the discrimination in treatment decisions that are often subject to time cost restraints. In addition, the more disease specific the type of the measure is, more likely you are to identify the quantifiable changes in your patient population. Consequently, when choosing an appropriate outcome pressure, it is necessary to gather certain information about the tools with the regard of their psychometric properties as well as ability to measure the change. Factor affecting the patient outcomes. First of all, clinical factors. Second one, non-clinical factors. When we talk about the clinical factors, the principal diagnosis severity, acute clinical stability, comorbidity, severity, physical functional status, and age. Non-clinical factors: health-related quality of life, cultural, ethnic, and psychoeconomic attributes, belief and behavior, patient attitudes and preferences, psychological, cognitive, and psychological functioning. Now table 2.2, 22.2, diversity of the outcome. And the outcomes can be clinical as well as non-clinical. When we talk about clinical severity of the principal diagnosis, acute clinical stability, comorbidity, physical functional status, survival. Non-clinical health related quality of life, resource utilization, cost of care, and satisfaction. Now we will talk about the psychometric properties. As a physical therapist, it is important to know whether or not the chosen treatment intervention are providing the higher level of the quality care for our patient. In other words, have we choose and implemented the most appropriate intervention for the patient based on the evidence to produce the optimal result? The only method by which to quantify an answer to this question is through the use of the outcome measure that reflect the highest level of objectivity. The question being, are we seeing a clinical significant change and am I able to measure that objectivity with the tool I have chosen? To answer the question, therapists not only be aware of objective measures available but also have a good understanding of their psychometric properties. Scherer highlights the various psychometric properties and should be considered when choosing an outcome measures. The suggested template by Scherer include the considering the intended population, validity, reliability, responsiveness, sensitivity, minimal detectable change, clinical significance difference, or minimally clinical important different MCID and suggested the uses in the clinic. This section defines each of these topics and provides the example of the each category. So we will discuss all these topics in the next upcoming videos. Keep connected, keep watching, And thank you so much for your time, your concern. Thank you.